Hello, Gab. How are you?
I hope we're not doing this
When's
when it's 30 degrees
when's
out.
Acme gonna? Yeah. When's Acme gonna knock on your door asking for their feedback?
When they tell us how to use the how to turn off the
Yeah, they'll tell us that. Oh, yeah. That is, yeah. Excuse me, look.
Hello.
Is the audio muted at the moment?
Yeah. I'll bring it up. Do you want another check? Do you want to check? Yeah?
Yeah. Yeah, no worries. Yeah, no, just getting a bit worried. It's all good.
Hello, Stephen.
Yeah. No, our master control rang up. Oh, we're not getting any audio from anyone.
Sorry. Me.
No, but you'd think.
It's all good.
I get a bit worried. I've got the other one as a backup on channel 4 anyway, so. Here we go.
Everyone right to go? Firstly, can I begin by acknowledging the fact that today is Police Remembrance Day, and we of course today pause to remember the 170 dedicated members of Victoria Police who've lost their lives keeping Victorians safe since Victoria Police was established back in 1853. There is a service which is happening now, and it will be the first time that the community will come together to pause and reflect on the contribution and the loss of 4 police officers who died this year in the line of duty. Today, the loss of leading Senior Constable Lynette Taylor, Senior Constable Kevin King, Constable Josh Presney and Constable Glenn Humphreys will be remembered as their names are added to the Police Memorial on a wall, which will forever remind Victorians of their bravery and the ultimate sacrifice they made on behalf of all of us. As the Premier of the State, can I say to you that my thoughts and prayers will be with their families today and with every police member and every police family on what will be a very challenging Police Remembrance Day. To live your life in the service and protection of others is an amazing thing. To lose your life doing that work is a terrible tragedy, and our thoughts and prayers and best wishes are with every police member and every police family today. Now, I can confirm there are now 326 active cases in Victoria, with 10 new cases since my last report. 326, that number continues to fall, just as so many numbers right across this pandemic and its response continue to come down in a steady and really very, very pleasing fashion. This strategy is working. This strategy is delivering us those lower numbers and I think an increased sense of confidence that we are going to be able to continue to take those safe and steady steps. There are 10 new cases, 3 are linked to known outbreaks and complex cases, 7 are under investigation and 1 was reclassified. There have now been, I'm sad to report, 794 deaths due to this global pandemic, 7 since my last report. 1 male in their 60s, 1 male in their 70s, 1 female and 2 males in their 80s, 1 female and 1 male in their 90s. 6 of those 7 deaths are linked to aged care, and of course we send our condolences and best wishes, our deepest sympathies to each of those 7 families. There are 46 Victorians in hospital, 5 of those are receiving intensive care, 4 of those 5 are on a ventilator. A total of 2,677,022 test results have been received, which is an increase of 8,226 since yesterday. That is a solid number, but of course we again take this opportunity just to urge any Victorian, any symptoms whatsoever, don't wait till tomorrow, don't wait till this afternoon. Please go and get tested as soon as you can. It's only then that we get the most complete picture so that we can take those steps with the certainty that needs to sit behind them. And of course we thank those 8,226 Victorians who got tested a bit over 24 hours ago. It's a really important part of our response. There are 4,273 total across the journey cases with an unknown source, a decrease of 1 since yesterday's report. There are 53 healthcare workers who are active cases. We send them our best wishes and we thank them and all of their colleagues for the simply amazing work that they do every single day. No new cases in regional Victoria today. That means there are 6 active cases of coronavirus in regional communities, so in regional local government areas under the stage 3 restrictions. That is a fantastic number, and one that I know every regional Victorian will be proud of, and we're certainly proud of them for the work that they've done to get these numbers low and indeed to keep them low. And that's a function of getting tested when you've got symptoms, following the rules, albeit they're very different rules, but the rules are still critically important to this strategy delivering the outcome we want, which is to have all of Victoria on the one footing at an appropriate time when it is safe to do that. In terms of the rolling 14-day average to the 28th of September, Metro 18.2 cases per day, regional just 0.6 cases per day. That is again, proof beyond question that this strategy is working, and that's something that is absolutely the work of every single Victorian who's following the rules and playing their part. That should lead to a sense of confidence and optimism that we've took a substantial step on Sunday, and we're well placed to take an even more substantial step towards that COVID normal on or about the 18th or 19th of October. Aged care active cases. There are 158 active cases in aged care. That is a very, very significant reduction in trend terms. If you look over the last week to 2 weeks, that number is steadily coming down, but it still remains a very vulnerable setting, and one that we're motivated and working very, very hard to try and do everything we can to keep it out of those particular settings. Active cases in disability facilities, it's now 2, so a number of cases have been cleared there, and those 2 are both staff members. Now, I've got a couple of follow-ups in relation to announcements that were made and clarifications that have been sought and given, and then I just want to take you through just a couple of metrics around contact tracing. Firstly, learner drivers. You can practice driving if you are out for one of the 4 reasons. For example, driving to the supermarket. You cannot go out solely for the purposes of driving practice. Weddings, there is no 5-kilometre limit, but you cannot travel to regional Victoria for a wedding unless you are the celebrant and you are working. Apartment complex swimming pools. All pools, indoor or outdoor, at residential premises, including apartment complexes, are closed in the second step. Only outdoor pools at non-residential premises are open in the second step. Travel for childcare. Yes, you can travel across the metro border for childcare, but the restrictions follow you, so you are subject to step 2 restrictions when in regional Victoria. You should not travel unless you really need to. So it's about trying to make sure, again, we've got as little movement as possible from Melbourne into regional Victoria, because any movement of that nature potentially takes the virus from Melbourne into regional Victoria. I know regional communities have been very highly motivated to make sure that we limit that movement. That's why Victoria Police really have stepped up their efforts at those checkpoints, and of course it's now a couple of weeks old now that we've had a much more significant fine, an almost $5,000 on the spot fine, if you are found in regional Victoria and you do not have a lawful reason to be there. There's just too much at stake. The last thing we want is, just as Melbourne's right on the cusp of coming down to those acceptable levels that allow us to open up more, to have this take a run in regional Victoria that's exactly what we're trying to avoid. So I just appeal to people, unless you absolutely, of course, it has to be lawful, but even then, unless you absolutely have to go, please don't go, because there is a risk that you're taking the virus with you. This is one of those lists that's been compiled because of a whole lot of different queries, so I'm not. It's not necessarily a list of importance. But the next one on my list is cricket nets. Cricket nets can be used in public spaces so long as they do not require facilities beyond that. Other restrictions apply, including 2-hour time limit and, of course, the 5-kilometre travel limit. Dog groomers, particularly in relation to animal welfare issues, which have been raised with us consistently. In Metro Melbourne, that is only in retail stores, not from home. It can occur from home in regional Victoria. Painters, Simon will be pleased to, well, maybe not with the answer, but he'll be pleased that I've come back to him. Emergency repairs can take place at occupied properties. That means no interior design, no renos if the property is occupied. Gardening and landscaping services by sole traders are allowed as long as it's contactless and can be done safely alone, and it can also occur on an occupied property given the nature of that work. It is indeed outside. That, I think, is all I needed to do by way of update, and if there are any issues arising from that list, I'm not going to interpret it for you. I will again put it back to the public health team to give any further consideration to any matters arising from those which are essentially rulings or judgments that the public health team have made. Just before we open it up for questions, I did want to just speak very briefly in relation to contact tracing. and the performance of our contact tracing teams across the board, I can confirm for you that as at the 28th of September, no cases are awaiting that first contact. The proportion of outstanding cases needing notification, so there are none. Everyone has been contacted within that 24-hour period. The proportion of outstanding cases that require interviews, no cases are awaiting interview, so 100% have been interviewed. And indeed, I can further report that just under 80% of those interviews are conducted within 4 hours. So not 24 hours, within 4 hours. And finally, the last of those three metrics, which is to have contacted close contacts within 48 hours, no close contacts are awaiting notification. So that is a very significant performance, and that speaks pretty much to the trend over quite a few weeks now. We've seen, obviously, when you're not overwhelmed by literally thousands of cases, then this contact tracing team, like any contact tracing team across the world, are in a position to respond even more quickly, and that's exactly what they're doing. And that should give every Victorian significant confidence that because of investments, because of improvements, because of just the position we find ourselves in and the nature of the challenge, that continuous improvement will serve us well as we continue to open up. I would just make the point, whether it be Hallam, Colac or the Latrobe Valley, that's just three instances where partnership with the community and contact tracing has been just outstanding in terms of pulling up those outbreaks at much lower numbers than might otherwise have been the case. That's just three examples. There are, of course, many, many others. But I thought it was appropriate just to give you an update, as I have done before. I might now just throw it over to you, to any questions you have.
In addition to the hotel inquiry yesterday said the Victorian government had failed. Your response to that?
Well, I'm going to await the report of the inquiry. Submissions were led by counsel assisting yesterday. It's an important part of the process, but an equally important, arguably more important part of the process is to wait until early November when Judge Coate will deliver her report. That'll have findings, recommendations, what's in that report, and what she calls for or believes to be appropriate is entirely a matter for her.
Once you get that report, will you look through roles within your government, such as that of Kim Peake?
Well, the most important thing to do is to wait till we get that report. I'm not sure what it will find. None of us can be certain what former Judge Coate will call for. We will look at that and we will take the action necessary very quick thereafter to make sure that these sorts of mistakes can never happen again. The exact nature of those mistakes, the exact nature of recommendations, what action is needed in the view of the Board of Inquiry, I can't predict what that is now. We simply have to wait for the report. I know it's frustrating, it is some weeks away, but when you've got nearly 300,000 pages of documents, many, many witnesses, many different issues, it's appropriate, and it's not only appropriate, but it is respectful of Judge Coate and respectful of the process to allow that to run its logical course.
Are you prepared to overhaul public service, change some of those departments? Do you think the merger, I guess putting so many things in DHHS has been effective?
Oh, Rich, again, I don't want to cut across what may or may not be in the report, but we stand ready to implement whatever changes that obviously we believe are necessary, and indeed any changes that the board may well recommend to us. It's somewhat challenging to speak to those recommendations given that they haven't been made yet, and the scope and the kind of the terms of any of those recommendations, that really is a matter for Judge Coate, but there will be no hesitation in taking the action that is required. I will take the action that is required to make sure that we do everything we possibly can to avoid anything like this ever happening again. That's important. It's a critical part of my job.
Minister Coates already told counsel assisting that she should find that your three key public service chiefs failed to keep you and key ministers informed about major problems in hotel quarantine that have claimed 768 lives and caused more than 18,000 people to become infected. Why do you need, is it even, given those findings, is it appropriate for you to maintain confidence in those people?
Well, Rachel,
another 6 weeks.
Rachel, if I want to be as respectful as I can, you've just put it to me that findings have been made. No findings have been made.
I said that
Yes, you
council
did. You said
assisting had recommended
No, I'm
to
sorry,
Judge
Rachel.
Coate that
Rachel.
she fined.
Rachel, it is my practice to listen very carefully, and what you just put to me was that Judge Coate had told. She said nothing.
No.
She said nothing. What's more, you just put it to me, and I'm happy if I've interpreted your question wrongly, or if it needs to be rephrased, we can go from there.
I told you what council
You just put it to me
assisting
that
had
there'd been
told Judge
findings
Coate
made.
She should find.
Well, we didn't actually say that, but in any event, let me go back to the first point. Well, Rachel, you didn't, and if you're going to put something to me, then I'm entitled to respond to it the way it's put to me. To do otherwise is one of these games where, in a couple of hours, I'm having all my words put back to me that I've somehow answered a question wrongly or I've been inconsistent. So accuracy matters. No findings have been made. Submissions have been made. No findings have been made. And it is not for me to tell Judge Coate what she should find. That is the role of counsel, but no findings have been made. So we'll respond to the findings when they are made. And that will be, and if they're made, that's entirely a matter for Judge Coate. As I've said a few times, I will wait for the report. You don't set up an inquiry to then essentially preempt or put yourself in the place of that inquiry. I've not acted that way, and I'm not going to start acting that way now. We will wait and see those findings. Whatever recommendations are made, whatever they may be, we will deal with those when they come
The
forward.
gravity of the recommendations that council assisting has made to Judge Coate.
Yes.
Are you satisfied that those 3 public service chiefs should stay in their roles and are safe to continue leading Victoria's response to the pandemic?
Yes, I am, and I will wait, as we all must. Whether we like that or not, we must all wait and see what the findings of the report are, the recommendations that may or may not be made, the commentary, the contents of that report will be very important. That's why we've set up this process. I would make the point to you as well that the submission process is not over. Council assisting have made their important submissions to Madam Chair, but others have an opportunity, not orally but in writing, to make further submissions. I think that expires next week. So that whole submission process, very important, but it is a far from complete process, nor is the Board of Inquiry process complete, given that the very report that former Judge Coate has been commissioned to write, she has not yet written. So again, I'll wait till early November and then we'll get a report, and the contents of that can be the subject of what I think will be a lengthy discussion and important action by me at the appropriate time.
The inquiry has heard that the department or the secretary of those 3 departments didn't brief ministers or the premiers about the hotel quarantine program. What kind of assurances have you sought that they briefed their ministers and also yourself on other elements of responding to the coronavirus pandemic?
I'm confident that those 3 public servants are acting appropriately.
But the inquiry heard that they weren't
I'm aware what the
relaying.
inquiry said. I'm aware what the inquiry said, and I'm aware what submissions were led by council assisting yesterday. You've asked me what assurances I've sought. I'm indicating to you that I'm confident that those 3 public servants, indeed all public servants, are acting appropriately.
And how are you confident? Have you sought a report? Have you sought a review?
I have confidence in those arrangements, Samaya. I'm not going to spend an hour and a half here every day detailing for you every conversation I have and every, really. I have sought assurances. I'm confident, and we'll wait for the report. And then the report will give us a sense, very clear sense, I would think, about what those next steps and actions need to be.
The report is about the report in the Board of Inquiry is about the hotel quarantine program.
Correct.
That the inquiry heard led to 768 deaths. I'm asking you
I'm aware what the inquiry's heard. Yep.
I'm asking you what kind of assurances you've sought from those department secretaries about reporting to their ministers.
And
about
I'm indicating
different
to you that I
elements
am
of responding
confident,
to the
and I'm
pandemic.
indicating to you, Samaya, that I am confident, and I'm not going to detail for you every phone call, every discussion, every meeting. I'm indicating to you in aggregate terms, in complete direct answer to your question, that I'm confident that those public servants, and indeed all public servants, are acting appropriately in the myriad of functions and tasks they need to perform as part of the pandemic response.
Why should Victorians have any confidence when the inquiry heard on multiple occasions these secretaries didn't brief their ministers on key elements of hotel quarantine program that led to 768 deaths?
Well, I'm not here to.
And you're not
I'm
telling
not here
them.
to speculate, Samaya. What I'm telling you is I'm confident that they are doing the very best they can, and they are acting appropriately. That's what everyone's doing. This strategy would hardly be working, as it most certainly is, if that were not the case.
So they're all briefing their ministers right
Well,
now?
yes, I believe they are, Samaya. And what I can also indicate to you is that if that were not the case, if the the broader reflection that you're making on those public servants or others, I would not be standing here reporting 326 active cases. Nor would I be reporting 10 new cases today when 6 weeks ago we had 725.
Premier, did, when Judge Codall, the inquiry, asked for an extra nearly $3 million, he said yesterday, the funding, did they say why and what that money would be needed
I'm not certain. It's not a matter. It is not a matter of me sitting down and trying to assess and second guess them. They've sought extra funding. I have faith that they have a genuine need for that additional funding, and there is an appropriate formality to this, Simon. It's not like a normal budget process where an agency might ask for some money and you would look very carefully. Indeed, we look line by line to make sure whether that's a fair thing. This is a slightly different process, and I think it's appropriate when extra funding is sought to complete the task that's been given to the board, that additional funding has been approved. If you want further information about where that money's, the sorts of things that money will do and help support, then I'd direct you to the board.
Can you release your, approval, which would show why they asked for it? Are you able to release any documents?
I could look into that for you, or you could ring the board and say, what are you spending the 2.7 million on? And I'm pretty sure they'll tell you.
That report could be one of the most important reports in our lifetime, in our history, and unlike other crises such as bushfires, we don't have a year till the next season to kind of act on it. That report has to be acted on immediately because hotel quarantine has to restart.
At some point, yes.
How quickly can you act on it? It falls on November 6th. How quickly?
I'm very confident we can. I'm very confident we can respond to the report of the board very, very quickly.
Within days of the report falling? Or?
Well, again, I can't give you a specific time on the basis that I don't know what's in it, but we will respond as quickly as possible.
Will you wait for that report before allowing flights back into Victoria?
Yes. That's been my consistent position. There's no point setting up a board that I think will go to these issues. It's not a matter of me inviting them to. I'm sure they will go to these issues. If they don't, that's entirely a matter for them. But I think it's important, as I made that point on Friday when I appeared, that I await their report so that we can take necessary steps. However, on that issue, because it's a prospective issue rather than looking back at the past, there's quite a lot of work going on so that we can be ready on that issue to set something up that is as safe as possible. So that's an advanced process because it's about the future. But it'll be one of those things where we want to leave room to be able to add to that framework in the event that the board puts to us that there's certain things we should do.
Do you expect ministers to take responsibility for what goes on in their departments?
Yes.
What about yourself? Are you not prepared to resign?
I indicated the other day I don't run from challenges, I don't run from problems. I'm not someone who quits to avoid doing the hard work that needs to be done.
So why
I've got a job, well, if you've asked me I would have thought rather serious question, and if I might be allowed to answer the question, I'll then answer your next one. I don't run from problems. I've got a big job to do, and I'm dedicated to getting it done. And that's not just getting these numbers down, but it's also delivering the most significant package of economic reform, investment and recovery that this state has ever seen. I can barely describe to you how committed I am to that task. And that, I think, is an expansive way of saying to you, no.
Okay, so why is it appropriate that Ms McCarthy resigns, but it's not appropriate for you to resign, and in your view, that would be you running away from challenges?
But that's
Well, you
not the
need to.
case,
You would
Mr.
need to
Martin.
ask her. She resigned.
asking you.
She issued. Well, again, she asked. You've asked me a question. What I'm indicating to you is, she resigned. She made a judgment she could not sit in the cabinet. Whenever a minister makes that judgment, then you've only got
You
one
said it was
course of.
appropriate that she resigned.
She issued a statement. That statement makes it very clear that she could no longer sit in the cabinet. Any minister that comes to that conclusion has no choice but to resign. That's the appropriate thing to do. That's exactly what I have said. Beyond that, if you want any more specificity about her reasons, then you would need to speak to her. I'm not in a position to elaborate on that. I appeared at the inquiry. I've not made a supplementary submission to the inquiry. If you want to speak to her about those matters, then I'd invite you to do that.
Are you
Do you think
implying that Ms
resigning is taking
Makakos is someone who
accountability?
runs from challenges?
No,
and quits?
not at all. I was asked a question, I've answered the question, and I've answered it, Rachel, I think, to be fair, in similar terms that I've answered it before, which I believe predates the decision of the Minister.
I've on another topic, Premier, the restaurant and catering industry, you may be aware of their roadmap that they've outlined this morning to try and get back. Wes Lambert's told us there were no cases of COVID-19 in hospitality business pre the second wave in Victoria, and so they're quite confused as to why the government continues to say that indoor dining is unsafe. What's your response to that? And,
Well,
what
indoor
can you give to
environments,
that industry?
well, with the greatest of respect to the individual that you're quoting, the doctors, the scientists, those who deal with this and have many decades of experience in the science of this virus and viruses like it, tell us, as well as international experience, that indoor environments are 20 times more dangerous than outdoor environments. That is the answer. The fact that we don't have known cases doesn't mean there were no cases. What's the number of mystery cases we've got out there? There are many cases that we simply don't know where they got it or where they spread it. The other issue too here is that it's very important that we do this in a safe and steady way, and that we don't do things that can lead to everything that's been done essentially being frittered away. Too much has been given, too much sacrifice has been made for us to take anything other than safe and steady steps. So I understand that many have very strong views on this. We'll get the place open as soon as we can safely do so. Just finally on this issue around dining, any setting really, this is not so much a direct commentary on the risk profile in those settings. It's about the movement that would be required of customers. That's the whole issue. It's aggregate. It's a cumulative thing. Not to take away from my very first point, Simon, and that is that indoor environments are 20 times more dangerous for the purposes of this virus than outdoor environments. I'm very proud of our restaurateurs, caterers, bar owners, cafe owners, publicans. They have done a great job to be as COVID safe as they possibly can. It's not a criticism. But it is a practical reality that indoor environments are far more risky than outdoor environments, and that's why in regional Victoria we've done some inside, 2 groups of 10, but 50 outside, and I'm working towards trying to have a similar outcome to that as soon as we possibly can. But it's subject to case numbers, and I'll just to be clear, I'm very confident that if we can get to that point, if the advice says that that's safe, I'm very confident that everybody across this sector will work very, very hard around cleanliness, distance, hand hygiene, staff health, so no staff members coming that's unwell, taking down the names of all the customers, all of that work. I'm very confident that all of the sector will rise to those very considerable COVID safe challenges.
Are you working on that towards step 3, which you...
It's too early for us to say, but we're in regular discussion with all of that. Well, many people in that industry. I understand that they want to get back not just for their profits but for their people, and we want them open too. It's a very big part of our story. It's a very big part of our story, and there's a lot of people employed, and it'll be a really significant marker that we have defeated this second wave, or at least we're, again, even closer to that than we are now, if we can get that outcome. But it's got to be done safely, I don't want to have them open only to have to close again. We want to get them open at the time when it's safe to do so, and they can remain open. That's a broader statement, I suppose, in many ways too.
What's the health rationale
industry
between
plan.
allowing cricket nets to be used? What's the health rationale behind letting cricket nets be used but not tennis courts without club rooms being open?
I'll have to get the public health team to come back to you, Rich. They've made a judgment. I think it'll be a feature of some nets in the park. There's an issue about shared equipment. There'll be things of that nature. But again, rather than me speculating on what that might be, with the greatest of respect to the cricketers out there, I've not spent a lot of time interrogating the public health team on that particular issue, but I'm more than happy to have them come back to you with any more detail if they have detail.
The 6 more deaths in aged care, when did they get infected?
I don't have that data.
Okay. Do you know if they died with the virus or from the virus?
I'm not the coroner, nor am I a doctor, so I wouldn't make that judgment. I've not sought to make that judgment at any point.
So why are people in aged care still getting infected?
Well, because this is a wildly infectious virus, and people in aged care are, whilst aged care is their home, aged care is not where the staff live. The staff live in the local community, and we have community transmission, and therefore the virus can spread. Sorry?
So it's still from the staff?
Well, it can be from many different sources, but it stands to reason if somebody has not left a particular facility, but there are different people moving in and out of that facility, and that there's no alternative other than to provide no care or have a situation where staff live in, which is many tens of thousands of people. I'm not quite sure where we put them.
So it's staff
Then there is
that's
sorry?
still causing the transmission in aged care right now.
Well, I wouldn't make a blanket statement like that. I don't think that statement could be read to mean all cases and all aged care. What I'm saying to you is that logic tells you that if you've got it in the community and you've got people by necessity moving from the community into these settings, that is a risk. The other issue too here is that not all of those who are connected, and that's the reporting we do every day, those deaths are linked to an aged care outbreak. Whether that person has in fact passed away as a resident in an aged care facility as opposed to a hospital, I haven't got that detail.
Is the aged care regulator doing its job? Only 13% of the centres that have had an outbreak in Victoria have been visited since they've had an outbreak by the regulator. Is that of concern to you?
Well, Rich, I'll put it to you this way. To the extent that I have concerns, I'll have a discussion with the federal government rather than necessarily speaking about those matters at a press conference. We are having a Royal Commission into this sector, and I think we're having it for a very, very good reason. Our focus is not so much on trying to emulate that process. Our focus is on trying to keep people safe, and the number of active cases, the number of outbreaks, the extraordinary measures that we've gone to step into a system that we have absolutely nothing to do with, I think should give everyone confidence that people have put aside differences, people have put aside, lines that have one system run by the Commonwealth and another system run by us. That's not the concern. The focus is trying to do everything we can to make these environments as safe as we can. But it's a joint and a shared thing. It's not. It is not a sector that's run by us. Despite that fact, we've had 5,000 shifts in those settings that have been undertaken by hospital staff, and I want to take this opportunity to thank them. And I can't say that there won't be many hundreds more. We're certainly working to try and avoid that.
Three of the 10 cases today you said were linked to complex cases. What are those cases?
The show release, I think, will deal with that.
Is 7 under investigation a bit of a worry? I know it's early, but we haven't had that.
No, I think. Well, again, we have. That is a higher number than it has been, but I wouldn't read anything into that. We may be able to close those out quite soon. Or not. That's something that we simply have to wait for the passage of time and the work that the detectives are doing. That's why, for instance, the fact that 80% of interviews are being conducted within 4 hours, and that's not just today, that's been happening for quite some time. That's at least my advice. I'm very pleased about that. Not using the whole 24 hours, indeed, just a portion of it, and making sure that we're on to close contacts and on to everybody as quickly as possible. That's a really important thing.
Can I just follow up on an earlier question Rich asked about tennis courts and the public health advice around that? Can we also get the public health advice around why skate parks are closed when parks are open?
I won't speak for the public health team. I've got a series of updates today that they've been spending quite some time thinking about, but I'm more than happy to pass that on to them and they can come back to you.
Professor Catherine Bennett says there's no epidemiological reason to say people within a heavily populated community must stay within 5 or 10 kilometres. If this is the case, why is there still the 5 kilometre radius rule?
Well, with the greatest of respect to Catherine Bennett, she's not the Chief Health Officer.
So
She
what-
can have views, lots of views. I've got to say to you, I'm not getting into this modelling debate again. I'm just not. We've got a series of decisions that have been made. This strategy is working. The numbers are coming down. And there are aggregate benefits that come from each and every one of the different measures that we've taken. They're taken on health advice. That doesn't mean that every health professional, every person from public health across the world would necessarily agree with every decision we've made, but you have to call it. You have to call these things, and that's exactly what we've done.
Why can't you explain the health risk of someone travelling more than 5 kilometres from their home?
Movement means virus. It's as simple as that. It's about reducing movement. That's what stay-at-home orders are all about. That's what just about every single one of the measures we've put in place, it's about reducing movement. If you've got more virus out there than you know, and that's a product of the fact that not every person with symptoms gets tested, what's more, not every person who has the virus gets symptoms. So if you have more virus than you have in terms of numbers, that is cases you know of, cases you've put a public health response, you've wrapped your arms around them, then if people are moving freely, then there is, logic just tells you, there is a greater risk, a far greater risk of people infecting others, and not just infecting people in their own family or in a circle that can be pretty easily traced, but infecting people that they have never known and will never know. It's nothing more or less than that. It is simply common sense. And it is very difficult to disaggregate each of the different measures that we've taken and apportion to each of them a separate public health return, if you like. That's very challenging.
Can I just ask a final question?
There is an aggregation of this and a cumulative benefit. Yes, you can, certainly.
Professor Peter Collingham says that masks are a good idea, but only if you can't do the basics such as physical distancing. And so if you're sitting in a park with 3 people who you live with, or if you're fishing by yourself, there's really no value in them. And if we have to fight coronavirus for a long time, we really need to have rules put down that make biological sense. So with that said, would you consider removing mandatory mask wearing and make it just an advice level
Not at this stage.
Why
At this
not?
stage, because that's not the public health advice. Again, I've made my point very clear on this. I think that it is very low cost and potentially very high benefit, and I think Victorians are doing an amazing job wearing masks. No one enjoys it. It's not necessarily something that you would choose to do, but it is a significant benefit, and that's the advice I've got. And people are free to provide both their scientific insight and their behavioural insights and their opinions and their views, and I welcome that. That's a healthy thing. But as commentators, as opposed to people who are actually making the decisions, I'm making it really clear to you that masks are here for a period of time. I can't tell you how long, but they'll be here for as long as the public health team put it to me that they have a significant benefit.
It just seems strange that they were originally introduced as our stage 4 of fighting the virus, and now we're getting to 5 to 10 cases a day, and everyone in Victoria has to wear them, even if they live by themselves, or they'll get
So
fined
what's
$20.
the significant burden or hardship with that
It's about, I suppose,
compared to the virus getting back to unsustainable
I
levels?
suppose it's just about having rules in place that make sense.
Well, no, I don't agree with that at all. It's about having rules in place that have a very low cost and potentially a very high benefit. I just ask every single Victorian today, and for so long as we have masks in place, it's not a comparison about it's not a question of whether you'd like to wear the mask, if I can say. It's a question between the imposition and the burden of wearing the mask versus the imposition and the burden of restrictions having to come back on because the virus gets away from us. That's the real question. And I don't even think it's a question, honestly. It is such low cost for such potential significantly high benefit that it doesn't make any difference. I'm not sure whether the taxi driver in Sydney was wearing a mask. I'm not sure whether all 15 or 20 of his passengers were wearing a mask. I just make a judgment. I would think, logic tells me, that might have been an easier process to deal with if they all had been. Again, no one's necessarily enjoying it, but it is a significant thing. It's working. It is playing a part to some extent, and there's very significant international evidence, whether it be in Germany, in South Korea, in Taiwan, in Hong Kong as well, I think. Very significant evidence to suggest that masks play a substantial role.
How's the state's stockpile of masks going? And are you handing them out?
Yeah, we've ordered a very large quantity and they've been distributed. I can come back to you. I'll get an update if you like on exactly how many of those reusable masks have been given out to people, and I'm very confident we have sufficient stockpiles in terms of those single-use masks of all their different sorts, because there are different kinds. But I'm more than happy I'll make that a feature of one of our briefings later in the week if that's of interest to you.
I think you announced 1 million maybe, or 2
I
million?
did. I had a series of shields, masks, gloves. No more than that. Closer to 2 in terms of the reusables.
Are they out there in the community?
I believe many of them are, but I'll get you an update. Well, why don't I make a feature if I can? I'll make it a feature of tomorrow. I'll have a bit of a chat to you all about PPE, stockpiles, and the distribution of those reusables. The vast majority of which were in fact Victorian made.
Sorry, an update on the omnibus bill and how negotiations might be going?
No, I don't. I can again just confirm for you that we continue to talk with the crossbench as we always do, but I don't have a specific update on it.
Victoria Police have asked the community to dob in their neighbours if they see gatherings going on, and people have reported that they've called police when their neighbours are having people over, or large amounts of people are turning up, and it's taking some time for police to get there, or they're not coming at all. Your response to that, and how do we...
Well, I would say to you, Chanel, there's been a very significant number of people that have rung the police assistance line to do just that, and I would, just as the Chief Commissioner's asked people to, if you think people are doing the wrong thing, then no one has the right to make that choice. No one has the right to have people over at the moment. It's just not right, and it potentially puts everything at risk. And if it was just a choice that potentially affected you and your household, well, maybe it'd be different, but it doesn't. It affects every single household potentially. Police assistance lines received a lot of calls. I'm very confident. My last discussion with the police minister on this issue, actually, which was only yesterday or the day before, Victoria Police are going to be out there in force, and they'll get to as many of those calls as they can, as fast as they can. I suppose if I'd flip it around, this is not something that I would do, well, because it's wrong and it's selfish, but it's not something I'd do out of any sense that, I won't get caught. I think there's a very good chance that you'll get caught, and police will issue the $5,000 fine. Well, just under, but it's as good as $5,000.
In your discussion with the Minister, did she perhaps raise an increase in calls since the curfew has gone?
No, it wasn't a conversation it wasn't yesterday, I think you'll find. So it was over the course of the weekend. I had a number of discussions about what additional enforcement activity can we do, what additional steps can Victoria Police take just to make sure everyone is doing the right thing. There are sadly some people out there who aren't, and I just say to them, not only is it selfish, not only does it risk everything that we're so close to achieving. We're just a few weeks away. We are so close to getting to the point where we can take some really big steps. Let's not any of us put that at risk. Let's not any of us do the wrong thing and potentially undermine this strategy. And then, of course, once those steps get taken, whenever it is that they can be safely taken, a bit like regional Victoria now, there'll be very different rules, but there will still be rules, and we'll all need to follow those. So at the point when we can move to one family partnering up with another family and being able to have that incredibly important interaction that everyone wants desperately, that doesn't mean you can have 50 people over to your house for a barbecue. That's very, very different. So there'll be rules all the way through, because there's no choice. If you just have a kind of free-for-all, then we won't contain this. We'll get to a point that's much closer to normal, but you can't cheat this thing. You can't just say, I want to get there, so let's just pretend it's over. We have to go through these safe and steady steps. And again, I wouldn't want anyone to just skate over the fact that we've got 326 active cases, which is a number that is rapidly falling. Only 10 new cases today, and whilst that's more than yesterday, the over the 14-day trend continues to be proof positive beyond any doubt whatsoever. 18.2 cases in metro per day, 0.6 cases in regional per day. That is something that every Victorian should be very, very proud of.
What did you make of the three blokes who were out on a fishing boat who had to get rescued by the police overnight?
Well, I'd hope in the first instance that they apologised to Victoria Police for having put Victoria Police in a very dangerous set of circumstances. I won't go any further than that. That's a matter for Victoria Police. But again, no one should be out doing things that are not in accordance with the rules. I'm assuming that it's been established that was not in fact in accordance with the rules. I don't think they were commercial fishers, were they?
No, they were. But there is some confusion over fishing and where you can do it. And
But if you can go fishing within 5 k's, then you can go fishing. But that's an appropriate thing. It's no different really than going for a walk. It doesn't involve shared facilities, shared equipment. It doesn't involve, I think, mass gatherings. If, however, we were to see, and I'm confident we won't see this, but if we were to see, you would recall some of the stuff down on the Mornington Pier. It wasn't necessarily all about fishing, but we did see large groups of people whale watching. I think it might have been at the time. What we can't have is these kind of pop-up large gatherings, and that's why, further to Chanel's question about Victoria Police, they will be going to places where people have from time to time gathered in groups, whether it be supermarket car parks, fast food outlet car parks, the list goes on. They'll be spending some time in those settings, and I think that's an appropriate decision.
Three brothers can go fishing together if they live in the same house, launch a boat, go out for 2 hours for a fish, and then come back. If they're within 5 k's of each other.
I'm not sure about the boat issue. Let me come back to you on that. Let me come back. I think there might be some physical distancing issues there, but if they're from the same house, potentially, again, it's always best not to do this on the fly. I'll come back to you. I think we're much more in a situation where people are, at the pier, or wherever it might be, or at a beach, or wherever it might be. Let me come back to you with a specific answer. I think the fishing community understand this. I don't know that. Look, I don't want to assume anything with the example you've given me. That is the overnight example. But if people are breaking the rules, then they shouldn't be doing that.
How's the prospect of the Boxing Day test with some spectators looking? Are we heading towards that, given that we're hoping to take the third step in a couple of weeks, and that's months away?
Well, there'll certainly be a Boxing Day test. There'll have to be quarantine arrangements for teams and officials and those who travel in. As I said yesterday, it's too early for us to talk about crowd numbers, what might be safe, whether it be at the Boxing Day test or the Australian Open tennis or any number of other really important events that occur over the summer, some of which are by their nature large crowds, some are much smaller. We're working very closely with all the authorities that run and regulate all those different events, and when we have more to say about those, we will.
Are spotless workers doing floor monitoring in hotel quarantine? Obviously, it's a scaled down program now. Work that was previously
I'll get
done
somebody
by
from the
security
Department of
guards.
Justice, the Attorney General, or somebody from her department to take you through any questions you have about that.
So you don't know anything about? Do you know if
I want to give you the most accurate answer that can be given, and I'm not going to give you assumptions. I want the most contemporary answer to that question, and I'll make sure that people who are running the program provide that to you.
Can I just ask Minister Foley a question just on that, around hotel quarantine and infection control processes that are currently happening?
Sure.
Obviously, the hotel quarantine program, it's really scaled down now, but what kind of infection control and prevention processes are happening?
So the quarantine program is now under the Department of Justice. but in terms of the sophisticated, high-level support that comes from health networks and DHHS in regards to that, when you say what kind of support, all the necessary support they need to make sure that those facilities are safe and that the learnings, both globally and locally, that are shared regularly are put in place.
Can you walk us through maybe what DHHS does in terms of training the workers there, and also regarding infection control and PPE?
In terms of both PPE, infection control, training, I know that there are significant protocols in place. In fact, I have a briefing with my department on that very issue this afternoon, and after that I'm more than happy to make sure that my team can provide you the most up-to-date details of that.
Are there still contract and casual staff working in those settings?
Those settings are managed now through the Department of Justice, so I'll have to ask the Department of Justice to confirm those arrangements
Previously, I
with you.
think we did have spotless staff,
I beg your pardon?
Previously, I think we did have some spotless staff working in that setting, some of whom had the virus.
That may well have been the case, but in terms of who's now managing those facilities, that's now done through the Department of Justice, and I'll ask them to confirm the most up-to-date arrangements for you.
Is it the Department of Justice or the Department of Health and Human Services that gives training to these workers?
Again, after I get my briefing this afternoon on that matter, which goes to all manner of arrangements in that space, which continues to evolve, I'll make sure that we get you the most up-to-date information.
Would you like to see Matt Hilakari? Would you like to see Matt Hilakari enter the Parliament? Staff member Matt Hilakari.
The matters of party pre-selection are a matter for the party office, and I will make no comment on what the party processes for casual vacancies are.
Don't have a preferred candidate, Mr. Foley?
Matters for party pre-selection are a matter for the party office, and I won't be making any comment about what's the party's responsibility. I'm too busy making sure that the fantastic progress that the people of Victoria have made over the past several months is maximised. Let's be clear, with now 326 active cases in Victoria, 320 in Melbourne, the tremendous sacrifices that the people of Victoria have made, that the businesses of Victoria have made, that our health workers community, all the way from our attendants, our cleaners, our clerks, all the way to the top ICU specialists, that enormous contribution has put us in such a fantastic position where we can rightly be optimistic about the near term. But that will only be achieved if we stay the course. And my focus is to make sure that I work with all of my health professionals, with all of the Victorian community, with every business, to make sure that we have a COVID normal, a COVID safe, and we get this last few steps to make sure that we have a normal as possible in the COVID world that we now live in the face of a global pandemic that is infecting millions and soon to kill, by the World Health Organization figures, millions, that we make sure that we lead the outcomes in a global sense and open in a COVID safe, COVID normal, careful, sustainable way. That's my focus rather than party pre-selections.
Sunday, Minister, you said not yet, you weren't aware, you weren't briefed yet on or confident that you were aware of all the contact tracing processes. I think you said the words not yet.
Yes.
How are you travelling with that in your brief?
I'm travelling, I'm a canvas on which many experts are painting their fantastic work. The rollout of the local public health unit network support is going well. We'll have more to say about that in the very near term. That will bring the Victorian system up to best practice very, very quickly. In fact, it might well take us to the lead. Add to that with the IT components, the work that is being done in the local regional communities, the links with the public health and primary health networks that many GPs have been calling for, the work with at-risk communities, the work in high-risk work environments, the work that's going on in partnership with the federal government in the federally regulated private aged care system, in our own health work environment. I am confident that all of that work is coming to fruition as part of a wider strategy, a population health strategy, where the cumulative effort of all of that work is making Victoria a COVID-safe place. We are almost there, and with a bit more endurance and a bit more support, Victorians can be confident that we will have the public health system in place to keep us open and not yo-yo in and out of waves of infections that we're seeing in other parts of the world. We have a chance to get this right, and I am determined, and the government is determined, and the Victorian people are overwhelmingly determined to make the most of that opportunity.
When will those hubs be up and running? Yeah.
Very shortly. Of course, some are already open, as you'll understand, in the regions. They've gone particularly well. The 3 will be very, very close to being opened, and they won't be the last.
And that IT system, when will that come online?
It's being trialled as we speak. I was with the relevant officials last night on this matter, and so far so good with all IT systems until you hit that go button, but so far so good, and we remain very confident that this will place us at the leading edge of the nation when it comes to the digitisation and the ability to seamlessly share data in real time quickly to make sure that those kind of 4-hour turnarounds that we're already seeing are maintained no matter what the numbers. It's all part of the one rich pattern. This is a population health strategy where if you take one pillar out of that component, you risk the whole thing. So that is why it's so important that all Victorians and all Melburnians stay the course.
Do you expect that to be up and running before the end of October, say, just for timeline's sake?
We'll have more to say about that very soon. So we keep our fingers crossed, but we are confident.
This morning that Australia as a COVID-safe nation is described the country. Is that premature? He's saying on the back of a run of low numbers for Victoria, we should now open up. Is he jumping the gun?
We'll work cooperatively with the federal government. We are working cooperatively with the federal government. I've spoken to Minister Hunt myself, and I look forward to further cooperation with the federal government. We're working cooperatively with other states. I've spoken with other states. Our goal is the National Cabinet goal, to suppress the virus and to open up cautiously, carefully and sustainably. And that's our goal, and that's what our population health approach to this issue is all about. And we are so close. So my message to every Australian and every Victorian is we are nearly there. Stay the course. Your tremendous sacrifice and commitment has been invaluable. We will get this.
Those 3 contact tracing hubs, I know that the ones that have been announced, I know they haven't been fully rolled out, but have any of them helped with contact tracing over the last week or so?
My understanding is yes, they have. That bringing local knowledge, diverse community knowledge has been invaluable. And it was prior to my taking over the portfolio, but I point to the tremendous work that Monash Health did with their refugee health service in the diverse communities in the far southeast. I think that has been the kind of model that we will see deep community engagement and intelligence. It's priceless, and it shows its value in those quick turnarounds to pull up infection spread as soon as you possibly can. It requires community engagement. It requires resources on the ground. but linked into a systems-wide population approach.
We knew Monash Health was helping out with or leading the contact tracing response in the Casey cluster. So there are other outbreaks or other COVID infections that have been, I guess, responded to by some of those suburban contact tracing hubs.
If I understand what you're saying correctly, so there's been...
So Monash obviously did the lead on Casey cluster.
Yes.
Have the other contact tracing hubs, have they done contact tracing work as well?
Well, for instance, the clusters, that the phrase you used is a very accurate description of the wider population health approach. We are seeing unprecedented levels of collaboration by all of our health networks into a series of geographic clusters, which will happily coincide with the operations of those local public health units. So the combination of the public health population-wide localised units, the health networks, the primary health networks, and the community engagement and intelligence specific to that community is the coming together of this that should give all Victorians the confidence that if there is an outbreak, as there will be under a suppression strategy, that we will have the best system in place. We are building the best system in place to respond quickly and decisively and pull that infection up so we can have a COVID safe and COVID normal summer.
And will this model, will it be a permanent feature of Victoria's public health team, even post-COVID, obviously on a much more scaled down level?
We are all learning right across the globe as to what the best public health responses to this wildly infectious novel coronavirus is. I would be very surprised if the learnings locally, nationally and globally don't put public health responses, population health responses, at the centre of public policy for many years to come.
Will this put us in front of New South Wales in terms of contact tracing when it all gets up to standard?
Oh look, we're part of a national response to this widely infectious disease and the infections. I'm not in competition with anyone. I'm to build the best possible system we can, and I want to thank New South Wales for their cooperation and assistance, and I want to thank the New South Wales Minister who has been particularly helpful to me, and indeed the other ministers across other jurisdictions who have been particularly helpful to me, and the collegiate approach that they have shown to me and to the Victorian approach, and us to them, can I say. They also acknowledge the kind of work that the digitisation work that we're doing. This is a shared responsibility because we all share the same values. That is, we want to make sure that we suppress this virus in the best possible way and sustain that. From that starting point, there is enormous cooperation. Politics as normal is out the door. This is far too important. This is about making sure that we, in a safe, cautious and sustainable way, open up into a COVID-safe summer.
Premier, if I can have a question for the Premier. There's been some suggestion that the delay in easing of restrictions might be able to upskill the contact tracing team, allow them to rise up another level. Is there any suggestions?
No, that's not right. It's not accurate in any way. If that were the case, then regional Victoria wouldn't have been able to open up well ahead of schedule. I wouldn't have been able to announce yesterday a whole range of changes that were not foreshadowed in the roadmap. There is an end-to-end digital product now. You've got to run systems a bit parallel so that you're not, because IT projects are always complex. But we are very well placed. Otherwise, we wouldn't be taking the steps we're taking because it wouldn't be safe to do so. And we certainly wouldn't be ahead of schedule, and we would not be essentially foreshadowing that in about 3 weeks' time. We think we can take another step.
Premier, have you been tested for the virus yet?
Nope.
You've been working so many days in a row and you've been holding lengthy press conferences. You haven't felt run down or haven't had a sore
No.
throat?
If I had symptoms, I would go and get tested, as I would ask all Victorians to do.
With that, sorry, just with that delay, so we've got that 3 weeks. Will that will be of some benefit, I suppose, to the public health team to be able to.
No, I'm not accepting the premise that there's some massive project to work. It's continuous improvement, an enormous amount of work. We're in a very strong position. Of course, every day presents a really important opportunity to keep on building, keep doing more. There are a few commentators on these things. I'll let them comment. We're just getting on and getting this job done. And if some of the fairly gratuitous commentary or even halfway accurate, then we wouldn't be seeing 320 odd cases active. We wouldn't be seeing some of the really substantial progress that we've made. But anyway, that's the politics of these things sometimes. The politics is of no use and of absolutely no concern to me. We're going to get this job done, and I'm grateful to all that team, and their performance has improved day on day. And again, it might not be convenient for some, but people need to acknowledge that the trip to Sydney was a really good opportunity to share information. Each side learnt things. Each state learnt things out of that, and that's where we find ourselves.
I mean, just on Police Remembrance Day, is there still plans on foot for a public memorial for the 4 police officers?
I can recall, Simon, when I spoke to the families of each of those fallen officers at some length, just in the days after, I made the point to those families that once restrictions permitted and there was an opportunity for all of us to come together as a state and to mourn their loss and celebrate their life of service, then we would certainly do that. But I would want to be always respectful of the wishes of those families. And of course, there will be a time, and I'd be confident, even if that happens to be, perhaps in the earlier part of next year, which will be sometime after the event, I'd be very confident that Victorians would come to a service like that and would participate. Just to say thank you to those families and to every police family. When you think about it, officers, sworn, general duties police officers, task force-based policing, PSOs, custody officers, that whole family, that unit, people who run toward the danger to keep us safe, they're a very special group of Victorians, and I've always supported them and I always will. And a day like today just reminds all of us what is at stake, the danger inherent in keeping the rest of us safe.
Premier, you told the inquiry that you came away from a National Cabinet meeting feeling as though there wasn't significant ADF help on offer for Victoria. Prime Minister's just said that there was an offer for ADF made at that meeting and it was up to the states and territories to how best to utilise that. Do you accept that characterisation of that meeting?
Well, I don't think that there's necessarily a great difference. New South Wales, it was very clear to me, would be receiving extensive support. The exact nature of their support, I suppose, was not necessarily clear to me, but they would be receiving, can I put it in this term, more support than others. That's not a criticism. It's a reflection of the fact that cruise ships, more international flights, that's what we all walked away from that meeting really clear on. Beyond that, as I've said, as I testified, and as I produced in a sworn statement, a more generous position than what I took away from the National Cabinet meeting was advanced by the Prime Minister at his press conference. And I acknowledged that in my press conference just a little bit after that. So I've got nothing to add to the evidence I've given on oath about these matters. They are true, correct and accurate. But I will not be going into who said what at National Cabinet. If the Prime Minister would like to invite me, or if you like, release me from the obligations that he, as the Chair of the National Cabinet, has imposed and is very keen to see maintained, well then he can update me about that and we could speak in freer terms. Any other issues?
Just one on mental health, sorry.
Certainly.
It's been a big part of your pandemic response. Do you plan on announcing a new mental health minister this week?
So Ingrid Stitt will be sworn into the ministry this afternoon, and I congratulate her on her elevation into Cabinet, and I'll have more to say about portfolio matters in just a few hours. By statement, I believe. I don't think I'll be doing another presser today if it's all the same to all of you.
So not saying to say Ingrid Stitt is the new mental
No,
health
she is not.
Okay.
She is not. but I'll make portfolio arrangements, announcements about those arrangements in due course.
A substantial reshuffle?
No, I wouldn't call it that. There's some substantial roles. Obviously, mental health is a very important part of our agenda and a very important part of not just the pandemic response, but that system needed to be rebuilt. And I thank Martin for the work that he's done. But it's not appropriate for him to hold both those portfolios. So there'll be a new mental health minister, and I'll make those announcements in due course.
The good people of Cardinia don't have any active cases. They're actually petitioning to leave Metro Melbourne. Would you consider allowing
Look,
them to
we're not
leave?
changing the Metro regional border. It's no cases we know of. Not everyone who's got symptoms gets tested. And even when you find cases, mystery cases, the nature of that is there's at least one other person out there who you may never find who gave them the virus, plus their close contacts. So it's 3 weeks. We're so close. Let's stay the course. Let's get this job done. Let's take a really big step in 3 weeks' time, confident that we've waited long enough, that the numbers are real, and that our prospects are likely, very likely, that in taking those steps we won't have to change the settings. We can continue to push forward. That's what we're all about. And if we start carving up, redefining the whole state, that's not necessarily conducive to that. So that is my answer. Any other issues? If not, thank you all. See you tomorrow.